MS Part 2. So the most common type of MS is relapsing remitting. Approximately 80% of individuals diagnosed with MS. They're notable for relapses which are followed by complete or partial return of function. The duration of these relapses can last anywhere from 1 to 3 months. Over time, the patient may experience longer and more severe relapses and lack of restoration of their prior level of function. Secondary progressive MS is the second phase of relapsing remitting if it is left untreated. So that's why it's super important that if you have relapsing remitting, you want to make sure that you're getting set up with a neurologist and getting that medically managed on top of getting PT for it. Secondary progressive MS is characterized by a progressive worsening of symptoms after the relapsing remitting has finished, and then frequently it causes progression in a bad way at a faster rate than before. Primary progressive MS is just a steady worsening of your symptoms without relapses or remissions. Progressive relapsing MS is a steady worsening of symptoms with intermittent acute flare-ups and worsening of function. So it can look sort of like it's going, like if function is high and decreased function is low, it's like a steady decline, and then suddenly there's a quick decline. You can kind of stay level for a bit. Maybe your function increases again, but doesn't get back up to where it was, and then continues to steadily decline. And malignant MS is the most aggressive and most rapidly progressing. On average, a diagnosis of MS shortens life expectancy by approximately 6 years. The positive prognostic factors are if you are diagnosed with relapsing remitting multiple sclerosis and if you have fewer symptoms at onset. The negative prognostic factors are if you are diagnosed with primary progressive MS, if you're an older age at the onset of your symptoms, if you have early cerebellar or pyramidal signs. Pyramidal signs include spasticity and muscle weakness and things like that. Smoking will certainly progress your disease process more quickly. Another negative prognostic factor, just statistically speaking, is in the African American population as well as males. And then if you have low vitamin D levels throughout your disease process, you have a negative prognosis as well. Early diagnosis and treatment produces the best results in the outcomes in individuals with MS. So it is very, very important that if patients start showing neurologic signs, that they go to their doctor, and if necessary that their doctor help them get set up with a neurologist, because the earlier we can catch this, the better your prognosis is going to be. Relapse management is usually managed by corticosteroids in the acute phase. Corticosteroids have a big impact on reducing inflammation, and because inflammation is what's causing the demyelination, then if we reduce the inflammation, then we can preserve that myelin and allow the oligodendrocytes to more effectively have enough time to lay down more myelin. Also, some disease-modifying medications that neurologists will be able to set their patients with MS up with, and the goal of these is to reduce the number and severity of relapses. It can also reduce the development of new areas of inflammation, so decreased plaque buildup on imaging, and then delay the progression of disability. It can also help act as immune system modulators, so if the hypothesis is that it's an abnormal response or an overactive response by our immune systems to the central nervous system, then if we can get something that can help modulate the activity level of that immune system, then we can hopefully decrease the progression of the disease.